I think my favorite story of all of them was when we had a practice eons ago. This was 2007, so almost 20 years ago now, in Atlantic City, New Jersey. And it was with the hotel and casino workers in Atlantic City. And these were sort of back of the house, dishwashers, etc. I was seeing patients in this practice, and the health coach came up to me. The model was really based on these folks from the community speak the language of the people they serve. And she said, Doc, there's a patient here. She's a hot mess. And I was like, really? So I walk in the door, and her name was Joyce, and she, was in and out of work and in and out of the ER, not taking her meds, and out of control diabetes and hypertension. And so, we got her hooked in, and she got a health coach, and she started coming to some groups. I ended up leaving the practice because I was trying at the time to start a second one. And then 6 months later, I came back to visit. And the doctor took over for me, Neil Patel. Neil's like, Rashika, remember that patient who came in the first week who we said was a hot mess? I was like, yeah. I was like, she's back. I want you to see her. And so I go in the room, and I barely recognize her. She's got her hair combed, little makeup on, glint in her eye as opposed to a dead look. I look at her chart. She had diabetes and hypertension under control, no ER visits. And I was like, Joyce, you look amazing. She said, Doc, I've never felt better in my life. And so I said, Joyce, help me out. What is it we did to help you? Like, you've had insurance for years and years, but obviously we did something different. And she said something very profound. She did not say, by the way, you have good protocols, you've got a good IT system, you've got a good payment model. She said, you all cared about me. You taught me to care about myself, and I didn't want to let any of us down. You cared for me. You taught me to care about myself. I didn't want to let any of us down. That is what changed her trajectory. And I think we often forget that in healthcare. It's a human to human interaction. And now, in order to do that, we needed to have the right payment model and the right technology platform and the right process and the right culture and all those things. But the sharp end of the sword is exactly that.